Welcome to the premier Gaucher podcast. My name is Amy Blum, and I am the Chief Operating Officer at the National Gaucher Foundation, an independent nonprofit dedicated to serving U.S. patients with Gaucher disease and their families. Through financial support, educational programming, patient services, and collaboration with medical professionals, NGF empowers Gaucher patients to live a better today. Today's podcast is focused on the basics of U.S. health insurance and how it affects Gaucher patients and their families. I am thrilled to be introducing our special guest, Aviva Rosenberg. Aviva is a healthcare attorney from Pittsburgh, Pennsylvania. She graduated with a BA in Politics and Women's Studies from Brandeis in 1997 and with a JD with a certificate in healthcare law from Northwestern in 2000. She has practiced law in Pennsylvania, Illinois, and Louisiana. After practicing for almost 14 years as a healthcare IT and compliance attorney with Sullivan, Stoliar, and Knight in New Orleans and Pittsburgh, she opened her own firm in early 2015, Rosenberg Health Law, that's located in Pittsburgh, Pennsylvania. She is taught as an adjunct professor at UNC Chapel Hill and Carnegie Mellon. Aviva's passion is educating about genetic diseases and screenings and talking about her journey with Gaucher disease, as well as being a parent of a child with Gaucher. Aviva, welcome to our podcast, and thank you again for joining us today.
Thank you. I'm happy to be here.
So during this time of year, which we often refer to as open season, many people are reevaluating their health coverage for a variety of reasons. It can be a maze of terminology, comparing benefits and costs, as well as other factors that are unique to each person's family. Figuring out where you even start can be an issue to begin with. So I'm sure for even someone like you who has a great understanding of the health insurance industry, there are challenges.
Yeah, it's a very overwhelming process, and it's even overwhelming. For someone who knows and has studied this for many years, it's very overwhelming. Our family personally just had to go through a change that was effective November 1st. So, over the past couple months, we had all the spreadsheets and had all the information out. And having a rare disease, there's many other factors to consider, which we'll discuss today. And when you actually make the change, once the change happens, there's even a more adventure to follow. In the past week since November 1st, I've been dealing with a new insurance company and a new specialty pharmacy, attempting to get my treatment. So on November 1st, the doctor sent the prescription for the drug to the pharmacy, the new pharmacy. I called on November 2nd. I said, okay, here, you got the prescription. Can I order the drug? They said, no, we didn't get the prescription. So I called the doctor back, and she said, okay, we'll send it again. So November 2nd, they sent it again. So I called on November 3rd. I said, okay, you have the prescription. Can I order the drug? They said, no, we didn't get the prescription. So then I called. So the doctor said that they had two confirmation sheets. So I called on Saturday. I said, okay, they have two fax confirmations. Can someone please go to the fax machine and get the fax and get the prescription? They told me no, that they were short-staffed and to call back Monday. So I called back Monday. And so now I'm 5 days in with very little drug left on hand. I called on Monday and they said, okay, well, we have the prescription from the drug company, which in this case was Genzyme. So I called my case manager, Genzyme, and he sent it in a few hours later. This was on Monday. So on Tuesday, I called the pharmacy. I said, okay, you have the referral, you have the prescription. Now can I get my drug? They said, no, we don't have the prescription. I said, are you kidding me? I feel like I'm living in some kind of alternate universe. Like, you had the prescription, now you don't have it. And they told me that they have the prescription from the doctor, but that's not good enough. They need to have a prescription on their own form. It can't be on the doctor's prescription pad. It has to be on their prescription pad. So they sent the prescription pad to the physician, and the physician, she immediately turned it around. She was also completely, she was completely dumbstruck by this entire process. So we're now 9 days into November. The change again happened November 1st. And I am not certain when I'm able to get my drug from this pharmacy, because every time I call, they seem to be missing one more thing. So the point of this story is I know exactly who to call and to get it done. And yet still, as a patient, I am unable to make it happen. And I can only imagine, how someone must feel when they don't know the numbers to call and they don't have the resources to be able to spend. I've spent over 5 hours in the last few days on the phone, waiting on hold, and that is really challenging. So this is sort of the way that our system is set up to inhibit people from, getting the drugs that they need. If they're very high cost, they're sort of gonna want to stop you at every point. So that's a little opening story. I wish I was able to tell a happy ending today, but I still don't know at what point I will be able to get my treatment.
Incredibly frustrating. And I'm sure, unfortunately, you're not alone with similar stories. But, perhaps a really good place for us to start is just with some of the basics, right? This is a maze. And as people are taking out those papers or looking on their computer screens as to what options they might have for the 2018 calendar year, let's maybe just talk about defining some of the terms that people are going to see, and to make sure that there's clarity and their understanding, and help them to make the most informed best decision themselves, their families. So let's start with the term deductible.
Okay. So there's actually been various studies that have shown, I know the Brookings Institute had one, that 90% of people in the United States have chosen the wrong plan based on financial savings. And a couple reasons that they give for this is, one, it's very easy just to, the status quo, you've had your plan for years, it's just easy to keep checking the box. Another reason is that people fear the high deductible plans because they see an initial output of cash, and that's very fearful. But with that in mind, that over 90% of people are selecting the wrong plan for their family and possibly spending hundreds or even thousands of dollars more than they don't need to. I definitely want to, define these terms so that when you're looking at choices, you understand what the difference is. So you asked about deductible, Amy.
Yes.
So I'm actually going to just switch it around for a second, because the premium is really the first thing you look at.
Okay.
So the premium is the fee to get health insurance. So that's what you have to pay to even be insured. So, whatever plan you choose, that's the cost to get it.
Okay. So that's the simple part. Not so simple, but
right. That's the simple part.
For your month, every month, this is and your premium is the amount of money you're going to pay out of pocket to whatever the insurance company is in order to have your health insurance coverage.
To have the privilege of having health insurance, correct? Okay. That is what you're paying, and this might have to be calculated. If you're getting employment-sponsored health insurance, then the premium is deducted directly from your paycheck. And so you might have to figure out, if you're getting paid every other week versus 26 pay periods, you need to kind of calculate that out to see what you're paying a year. And that's a different calculation if you're getting a biweekly paycheck or twice a month or monthly. And so you want to look at that deduction out of your paycheck to really figure out what you are paying in premium costs for the privilege of being insured.
Okay. And then we move to the thought of what the deductible for different plans might be.
Correct. So once you've paid the premium and you have health insurance, you're covered. Then the next thing that the health insurance company the next important number to look at is your deductible. So the deductible is and it works the same in auto insurance and homeowners insurance, renters insurance. That's what you have to pay out of your pocket before the insurance company will pay anything. So yes, you have health insurance. That's what you paid for with the premium. But the deductible is what you have to pay in order to get the insurance to kick in. So this is where, high deductible versus low deductible plans kick it, where the difference becomes very important. So in a regular standard insurance plan, you're paying a pretty high premium and you have a low deductible. So the deductible might be maybe $1,000 for an individual and $2,000 for a family, meaning that once you spend $1,000 for you, then everything else will be covered at a certain percentage level. So either either the insurance will pick up 80% after that, or they'll pick up 100% with copays of $50 or $100. And this will all be listed on your chart. So that's a low deductible plan. Now to get a low deductible plan of maybe $500 or $1,000, you're going to be paying a very high premium, because that money is going to pay for the ability to have that low deductible plan. Now, so the high deductible plan, those numbers are quite shocking when you look at them in the chart. So it might say that your deductible is either $3,000 for an individual or $6,000 for a family, meaning that you don't have any coverage until you spend $6,000 for your family. That's a lot of money, and that is very, very scary to people to see that number. Like, how you're thinking, how would you get $6,000 before you even get insurance? But you have to look at it over the entire year and the cost savings that you would receive by having a very low premium. So if the difference in price, if you remember, your premium is what you're going to be paying every month or every other week out of your paycheck. So you might find that the difference in the price of the premiums is big enough that the deductible, the additional payment and deductible is the overall cost of a high deductible plan is lower. Does that make sense?
It does make sense. So you're looking at how much you're going to spend on your premium over that 12-month period.
Correct.
Like a low premium, a low deductible versus the high deductible. And if you look at the two different costs of those premiums, factor in the cost of the deductible, you might find that even with the higher deductible, you're paying less money in total.
Correct.
Out of pocket, because the premium level is low enough that it's going to compensate for the difference in the deductible.
Correct. And of course, it's even more complicated than that, because these high deductible dollars. So let's take, for an instance, your high deductible is $2,000 for an individual and $4,000 for a family. That's a standard high deductible plan. You know, it might vary. I've seen $3,000, $6,000, but let's go with $2,000, $4,000. Those dollars can be paid for with pre-tax money if you have a health savings account. So you get an additional savings there. So it's a lot of math. But if you're thinking about it, so if you're thinking that you have a $4,000 output, that's $4,000 of post-tax, pre-tax dollars. So
Okay.
It's really the cost is really less than that,
because you're not paying taxes on that money.
Correct.
It's coming out first, pre-tax.
If you have set up a health savings account, which we'll talk about in a little bit, how to do that. And so there's a lot. It's not as simple as looking at a chart. The insurance companies, they want this to be confusing. This is purposely confusing. It's not designed for the average person, and really you need a PhD in math to sort of understand it. So there are people that provide services. Most cities, you can Google like insurance help, and and you can go to these places. There's often free clinics and community centers, YMCAs, JCCs that can with people that are very educated in this, much more so than I, that can work the numbers for you and for your particular family situation. But do not rely just on solely looking at the chart of your first impression, because the numbers often will be misleading.
Right. And another thing that I have personally found is it's very important to look at the differences also in what is included and covered. So it does beg for more calculations, especially when you're really trying to figure out and fine tune what's right for your family.
Absolutely.
Because then the whole issue of copays, which we should define, comes up. Where do you have copays? What is that copay? How frequently are you going to be at those different physicians and use them? So how would you define copay?
So a copay is what you're going to pay every time you show up for a particular service. That copay may be for a physician's office, it may be for a laboratory test, and they're often defined, they could be different. Some of them are set copays. So you may pay $25 when you see a primary care physician, $50 when you see a specialist, or you may pay a copay, maybe a percentage. So maybe it's 20% of your laboratory test, 20% of your diagnostic MRIs. And so that's how the copays are defined. Now, going back to our two different kinds of plans, when you meet a maximum out of pocket with a high deductible plan, oftentimes it is designed so that once you meet that high deductible, you've spent your $4,000 or $5,000, there are no more copays. This is something you have to check. Sometimes, sometimes there still are, but sometimes once you expend your maximum out of pocket, then the copays will go away, and so you won't have those anymore. Whereas in your regular plans, that no matter what, you will still have copays until you meet a maximum out of pocket, which is often much, much higher. That maximum out of pocket might be $10,000, which a lot of people never meet.
Right. And then often there's another factor that can confuse people, and they talk about in-network and out-of-network. And I think that would help give our listeners a deeper understanding of where those fees are going to start to come in and maybe where there might be differences.
Yeah, Amy, it's interesting. I was speaking with a colleague this morning, and apparently in-network and out-of-network has gotten even more complicated, because she was telling me that her plan has preferred in-network providers, regular in-network providers, and then out-of-network providers. So it's no longer just in-network and out-of-network. Now she had 3 levels to consider. Whether her doctors were preferred providers, meaning that they got a really special, a low budget rate. Then there was the in-network, so they were just the regular in-network rate versus, and then finally, out-of-network, and that would be covered at a much lower rate. So, insurance companies are getting trickier and trickier, and they're obviously looking to preserve their money and to make money. A lot of them are publicly traded companies, and that's what their goal is. So, when you selecting a plan, if you have the ability, first make sure that your doctor is in the plan covered, and preferably in network. And if they're preferred in network now, that would be even better. And then if they're not in network, obviously we at the Gaucher Foundation and Gaucher patients and rare disease patients, we really have specialists. So we don't have the ability to just switch another doctor that's in our plan. We have to stick with our specialist that has followed us for years and really understand what's going on with our health. So if you're going to have these out-of-network appointments, that's something else to figure into your calculations, since we can't easily switch providers.
Right. So it could make your head feel like it's just revolving around in 360, right? And,
yep.
And a lot of information to process, a lot of calculations. So we talked about, very briefly, you mentioned earlier, a health savings account, and those are often known as HSAs. And then there are flexible spending accounts also that some people have options as well. And there's some differences. So let's talk a little bit about these HSAs and FSAs so that people are equipped and understand the language and can go and ask questions at their employers or their HR, so they know what might be available to them to choose as well.
Great. So the FSA is something that's been around for years and years, and that stands for a flexible spending account. And so the way that has worked over the years is you can tell your employer to take a certain amount of money out of your paycheck, and it goes into an account, and then you can use it for any type of healthcare expenses, anything from copays to eyeglasses to Tylenol even. And what you do in order to get that money, it's taken out of your account pre-tax and held in an account in your employer. But in order to get it, you have to bring in receipts, and you have to submit the receipts to your employer, usually the HR or the administrator, and then they'll cut you a check from your own account. So these are very, very cumbersome. And, while they're useful, you're paying for these expenses with pre-tax dollars. It's a lot of work. The other thing about them is if you don't spend every single dollar, then you lose it. It goes away. And you don't get to keep it. Even though it's your money, it reverts back to your employer. So these people are very fearful of them. I had this option for many years with my employer, and it just seemed like so much work and so much effort. And then, all of a sudden in December, when you realize that you have, $1,500 left in your account, you're buying ridiculous things that you don't really need just because you don't want to lose the money. So, if you have this option available to you, it may be worth looking into because it is pre-tax dollars, but we're recognizing that it is quite cumbersome. A better option is a newer option, and that's called a health savings account. So, or an HSA. So these are either through your employer or they're on your own. So you can qualify for a health savings account if you have a high deductible plan. And so if you have a regular insurance plan, a low deductible plan with a high premium and a low deductible, an HSA is not an option for you. So your only option to pay for your extra healthcare expenses would be an FSA if it's available. So let's talk about what an HSA is. So if you select a high deductible plan, opening an HSA is a no-brainer. And I would say it's something that you have to do. You have to open the HSA to have with the high deductible plan. So some employers offer this option and they do it for you. And they actually will go ahead and put with the money. You can tell them how much money and they'll put it in your account. And then you get a debit card. So when you go to the doctor's office or you go to the pharmacy, you just use that debit card and you charge it right there. So you charge your copays, you charge your drugs. You have complete control over the money. It's your money and it's your account. If your employer doesn't offer it to open it for you, then the best thing to do is open your own. And pretty much every bank offers different HSA accounts. So you can go to your neighborhood bank where you already do your banking and ask them. If not, there's a ton of online banks. I know Vanguard, KeyBank. You can Google HSA plans and find the bank that you're most comfortable with. Again, you're going to get a debit card. This money is pre-tax. And so whatever you put in there, it's your money. You can spend it on healthcare. You can spend it on your high deductible. And then you can spend it on any other things. And if you don't use it all, it's not a problem because it rolls over. You could use it the next year, or you could put it away for retirement. There's various options of what you could do with the money. So I am not a CPA, so I don't know all the tax rules. But I do know that some CPAs recommend putting the maximum amount into these HSAs as another way for retirement planning. So if you have the cash to be able to put the maximum amount away in the high deductible plan, even though you may not use the entire $4,000 and some dollars, it's another way to sort of shelter money for retirement that is tax-free, that is until you withdraw it. So, you may want to check with your CPA if that's an option for you. Again, remember, you can only have this account if you select a high deductible plan.
Okay. That's really very interesting and adds to the complexity of everything that has to be considered. It makes me think, just as an aside, often you just get these one-pagers, if you will, that the insurance companies provide to give you the bulleted overviews. Is there benefit to going and asking for more detailed, kind of get an overview of a few plans that you think might be worth investigating more, and then go back and say, I need more than a one-pager to be able to take a look at all the different aspects of what you'd be purchasing with these plans and the deductibles, the premiums, all of those things together?
Absolutely. Like I mentioned earlier, a one-page chart does not tell you the whole situation. So, to get a better understanding, you can depending on the size of if you're getting insurance through your employer, and about 50% of Americans get insurance through their employer, which is every year it goes down lower and lower. So your employer will often have either a consultant or an HR person that can discuss this with you further. Now, it's their job to know the details of this. And so I would say utilize their services. If you're unsure about something, go and sit down with that HR person and tell them the situation. Tell them, what you're looking for. Now, if you're buying insurance through the ACA, the Affordable Care Act, through one of the exchanges, there are, like I said, I recommend the services of, various free opportunities that are set up around the city or on the phone. If it's too difficult for you to go to a clinic, but really you should talk with someone to get information, because these calculations are so hard that unless you have a PhD in math, you're going to need some help with it. And so there's services set up that can help you. And don't try to just look at a one-page chart and think, like, based on that you're going to choose the right plan for your family. Because there could be a substantial cost savings, and I'm sure everyone would like to have a couple extra $1,000, especially around this time of the year.
Right, for sure. Okay, so far we've talked about some basics in terms of key terminology, and we've been talking about private health insurance purchasing. Then there are two other terms that people have heard and maybe are not clear about. One is Medicare and one is Medicaid. So let's talk about those two different programs, government programs, and let's start with Medicare. What is it? And we hear parts A, B, C, D, and let's talk about all these differences in the parts and when they would be appropriate or applicable to someone.
Okay, so Medicare is the government health insurance. It was started in 1965, so it has quite a track record by this point. And it's for ages 65 and older, end-stage renal disease, and certain disabilities that you can qualify for after you have been on Social Security based on your disability. Essentially, if you're thinking of Medicare, you're looking at your population that's older than 65. Almost the mass majority of people having Medicare are ages 65 and older. So within Medicare, there's lots of different options. So if you go with your standard Medicare, Part A is covering for hospital services. Medicare Part A reimburses hospital services. Medicare Part B is for physician services. And so if you're buying standard Medicare, you're going to need Medicare Part A and Medicare Part B to cover your complete health care. Of a more recent development, not recent anymore, but probably about 20 years, they came up with a Medicare Part C, or also known as Medicare Advantage. So what this is instead of buying your health insurance sort of directly from the government has contracted with insurance companies to offer a comprehensive plan for people that otherwise could be covered by Medicare. So these plans will cover your hospital, your physician, sometimes drug coverage. A lot of times they will also have certain benefits like gym membership or vision, dental. Each Medicare Part C plan is different, but depending on your health and what you're looking for, a lot of people really enjoy having the Medicare Part C, the Advantage. It works more of like an HMO type plan. You will be restricted in which physicians and hospitals you can use. Unlike Medicare's Part A and B, where any doctor who takes Medicare patients you can go to, Medicare Part C works more like a PPO, where you have specific choices depending on which plan you choose. It's generally geared for healthier elderly patients, since again the insurance company wants to pay out as little as possible while keeping their patients healthy. So you're going to be encouraged to get well checks, preventative care. These are all good things. But again, most important, if you're deciding, or if you're new to the Medicare program, if you have a physician that you've been seeing for 20 years, you want to make sure that physician is part of the Medicare Advantage plan. Otherwise, you would be unable to see him or her.
Okay, and then sometimes we hear about Part D of Medicare. So what is that?
So whether it's Part A and B or an Advantage plan, none of these Medicare plans cover everything. And there's often huge gaps in their coverage. The biggest gap is for drug coverage. So Medicare does not cover drugs, and so you need to have a supplemental plan. And so the supplemental plans are sometimes known as Part D. And again, these plans are offered from various insurance companies within your region, and they have a whole host of different supplements. Some of them offer, complete drug coverage. Some of them offer partial drug coverage. Some of them offer to pay copays for your Part A and B plan. There's really a very vast array of different types of supplemental plans. And so that's something that you want to investigate depending on your region and what the supplement covers and whether it's beneficial for you. But anybody that has a Part A and B definitely needs to purchase a supplement.
So, I'm listening to this wealth of information that you're sharing, and when now more and more people 65 and older are still working, they're still employed. Whereas it used to be that age 65 was the age of retirement, and that might not be the case. So for some people, they may have an HR person to go to talk about this added option. If somebody is age 65 or they think that maybe they might qualify for Medicare based on other health disability issues, who do they go to? Where can they go to talk through some of this?
That's a really good question. There are resources for Medicare patients that if you go to medicare.gov, that's medicare.gov, G-O-V, there are a lot of resources on that website for Medicare patients that answer a lot of questions, frequently asked questions. They also provide several different 800 numbers that that can help you out with answering your questions. And very often there's, I see advertisements for information sessions and the like around the community. You could check in at your local community center for resources there as well.
Wonderful. So we've now covered Medicare and we've heard of Medicaid. So what is Medicaid? And then for whom is it applicable to maybe be considering and looking at?
So Medicare is a federal government program. Medicaid is a state program that's funded partially by the federal government and partially by your state government. So the service is provided by Medicaid, and it has different names in different states. For example, in California, they call it Medi-Cal. A lot of the states call it, they might call it the Access Program. And so it might not be what the insurance program is may not be called Medicaid, but that's in terms of funding, it is a Medicaid program. And it's a combination of federal and state dollars that are funding this. It is available to pregnant women, children, and people with disabilities under or over the age of 65. So if you have a disability and you're over the age of 65, oftentimes you're what's called dually eligible, meaning that you're eligible for both Medicare and Medicaid. And in fact, even people under the age of 65, if they have a disability that's been qualified for Social Security, you will be a dually eligible as well. So that means you'll have Medicare and Medicaid. Medicaid is always a payer of last resort. So what that means, if you're eligible for any other plan, if you're eligible for Medicare, if you're eligible for some other employment plan, if you have insurance from another person by, married or spouse or dependent child, your Medicaid plan is the payer of last resort. So that's where they'll go to last to get the money.
Okay. So then we have a whole nother, a few other questions that pertain to our community in particular, because there are differences, right? You mentioned specialty pharmacies for very expensive drugs. I don't know that there's anything that you can look at from plan to plan to see what those pharmacies are and who they are to begin with. And perhaps if someone in the Gaucher community is on an enzyme replacement therapy, where they are hoping to go for infusions may play into what a particular policy may offer.
Yes. So within the rare disease community, this affects us very personally. And different insurance plans have different ideas about, how these specialty drugs and delivery systems work. Over the years, I had one insurance company that insisted I get my infusions in a hospital setting, despite the fact that I had been in home care for years. And so I had to switch back to going to the hospital for getting infusions while I went through the appeal process. And I actually had to draft out a graph showing the insurance company why it was so much more cost effective to them to let me have the infusion in home. And so a lot of these different rules that they have, you don't know that when you're selecting a plan. It doesn't spell it out in that one pager you mentioned. And so until you actually select the plan and get enrolled, you won't know. It's really, you'll have to figure out, or your pharmaceutical company rep will help you figure out where your drugs and what the system is going to look like with this new plan. So that's why I feel we're very, very lucky to have strong pharmaceutical partners in Genzyme and Shire and others that are able, they have case managers that are able to help. And so by all means, if you have that ability, if you have a case manager, utilize their services, because they are experts and they can really help you through this maze of getting the drug from your insurance company to your front door or wherever you need it to go.
And so if we're in November now, and this open season only gets us through, I think, mid-December this year. Once you've made a selection, if there is a change to your plan, should patients be contacting their case manager right away to let them know that they've selected a new plan, what it is, and give time to start to develop those contacts with the particular specialty pharmacy and figure out if location of infusions are going to have to change?
Absolutely. In fact, I encourage you to contract your case manager when you're choosing a plan. I know we did just a few weeks ago, and because many of the patients are enrolled in various patient assistance programs, either through the NGF Care program or directly through a pharmaceutical company, there's different patient assistance programs that actually can help cover a deductible or copays. And so so your case manager can help you decide on choosing a plan if they're able to cover some of those costs. And that might be a huge variable for you when choosing a plan. So if you know that you don't have $1,000 to pay for your first infusion, if that cost is covered under the deductible from the care program, or if you're enrolled in a different patient assistance program, that might make that decision a lot easier for you. So I encourage you to contact your case manager or the NGF Care program when selecting a plan to confirm that those costs could be covered. Now, you don't want to assume it. You don't want to assume that a deductible or a copay, because it was the year before, would be covered under the new plan. So that's why it's a good idea to get them involved with helping you select, and they could help clarify which fees they could pay for and which fees they can't pay for.
So you've brought up a great point that we hadn't discussed previously, which are what are called PAPs, or these patient assistance programs. They're financial programs to help assist in payment for, could be your health insurance premiums or a sundry of other things. And there are many of them. And as you had stated, the National Gaucher Foundation has our care programs where we do offer these kinds of assistance for families who are eligible, 400% or below the annual poverty level that's defined yearly changes through the government. And it could be for paying for health insurance premiums, or there are other aspects in the Care Plus program, but we're not unusual. There are others. So what types of things might be covered under different patient assistance programs, and what factors might someone want to be considering as they're trying to look for them?
Right. So as you mentioned, patient assistance programs vary a lot depending on the sponsor. So some programs focus on premium coverage. Some focus on copayment and deductible assistance. Some focus on any type of copayment that is related to testing for Gaucher for your particular rare disease. There's also a rare disease foundation that has additional help and assistance for patients with rare diseases. So basically these are all things that you want to see. So if you're enrolled in a patient assistance program that would help you with premium assistance, then obviously you maybe want to consider a plan that has a higher premium if you're going to get assistance with those premiums. Now, if you're enrolled in a patient assistance program that covers deductibles, so naturally you'd want to choose a plan with a low premium and a high deductible if you're going to be able to get help in that way. So these are only for private insurance. These patient assistance programs cannot help you if you have Medicare or Medicaid. But again, it's another calculation to figure out when you're selecting, and your case manager can help you with those as well. And I think the NGF, the care program administrator, she can help as well.
Right, that would be Barbara Lichtenstein. And in fact, right now it's that open season. So in terms of anyone who might be interested, they can certainly reach out now. For 2018, the CARE programs are taking applications, and that will close, I believe, mid-December. So any other tips? Anything else that we haven't covered that might be useful for the community?
My first tip is to take a deep breath. And know that you're not alone. This is extremely stressful, and it's overwhelming, and it's just very nerve-wracking. So I would say the first step is to really take a deep breath, and know that there's people out there, there's assistance programs out there to help you through this. And so you should never feel like you have to sit at a kitchen table alone at night and work through this. Utilize the assistance that is out there. And then I would say that don't be scared to change plans just because the other plan is what you've always had. There could be substantial cost savings to your family for making that change. And so I would say investigate it and don't go with the status quo, and see if there's a better option out there for you and your family.
Wonderful. Aviva, this has been so enlightening and helpful. I know I have certainly learned a lot in this short time period of talking with you. And this is all the time that we have for today. So I thank you so much for sharing your insights on such a vital topic, especially for our community. And as an expert in the field and as a parent of a child who also is living with Gaucher, I thank you for sharing your experience and helping the larger Gaucher community. We are very grateful for your time. And I think
it's been my pleasure.
Thank you. And I thank our listeners, for tuning in with us today. If you want to learn more about Gaucher disease or the National Gaucher Foundation, please visit our website at Gaucher Disease, that's GaucherDisease.org. You can sign up for our monthly newsletter, read articles and blog posts about living with Gaucher disease, as well as patient stories and videos. You can also be in contact with an optimal health advisor that we have here on staff. They're able to listen to what your needs are and help guide you to resources that are available. And for sure, follow us on Facebook. Please check back for future podcasts from the National Gaucher Foundation. Thank you, and we hope you'll join us next time.